Antibiotic resistance is a global public health threat, but nowhere is it as stark as in India. In 2010, India was the world's largest consumer of antibiotics for human health. The overall burden of resistance is hard to access for the general population, but the most vulnerable sections are the neonates and the old aged. A mix of poor public health system and hospital infections, high inexpensive antibiotics, and rising income is coming together to increase prevalence of resistant pathogens and untreatable healthcare associated infections. Today we'll talk to Dr. Sanjeev Sehgal, who will tell us about the problem of drug resistance issue in India.
The most important thing is that all the hospital staff must wash their hands properly before touching a baby. These so-called alcohol-based hand scrubs, they are equally good. Unless the hands are really soiled, there is no need to wash also, but they have to scrub their hands with these hand sanitizers. Babies should not be unnecessarily kept in the nurseries, because then it can lead to an epidemic or infective scenario. Unnecessary use of preventive antibiotics should be minimized, and unless the child is too sick and there is no time, if we start with an antibiotic, we should send all the culture reports prior to starting an antibiotic, and if the child improves and the antibiotic results, the culture reports are negative, then we should think of stopping the antibiotics, or we should step down from a broader spectrum to a narrow spectrum antibiotic whenever the culture reports are available. In India, say 1 in every 4 deliveries is carried out by untrained guys. So the utmost important thing is that we should educate them regarding the role of washing hands and using gloves and performing the minimum number of per vaginal examinations, and they should be told about the importance of sterilization of instruments. They should use sterilized or boiled instruments, and they should avoid unnecessary PV examinations, and they should be in a position to recognize a prolonged labor and refer them to the hospital as early as possible, because most of the deliveries, the infections occur either during the procedure of delivery or before that. Every hospital should have an antibiotic policy. Like in such and such infection, such antibiotics should be given. Start them on broad spectrum antibiotics unnecessarily. In case there is a need to give a higher antibiotic, there has to be a surveillance committee or antibiotic committee in the hospital. I think that is the need of the hour, and all these antibiotics should not be available off the counter. They should be, one can only buy them once they have a prescription of a specialist doctor.
Besides, what is important is the behavioral change among the patient and the physician. India has won many battles primarily against the tobacco consumption at workplace through regulations and behavioral change communication. Similar campaign could be run in order to educate people about the dangers associated with the use of antibiotics. All these things, if taken care of, would send a strong signal to the country's commitment to tackle this issue and thus reducing the infant mortality rate.